So this is a 64-year-old male who presents with hindfoot pain. A marker has been placed in the area of interest, and we begin to see that this is the region of the plantar musculature. Moving from medial to lateral, we have that abductor hallucis with its central tendon and plantar fascia. We have the flexor digitorum brevis, usually has some variations but can have a medial and a lateral head. And we have the abductor digiti minimi. Deep to those structures, we have the quadratus plantae, which in this case is looking rather small. Let's take a look at that on the oblique coronal proton density imaging. There's some slight motion, but we can still make out the medial malleolus, the lateral malleolus. Coming into the region of the fat-suppressed musculature, what we're seeing is that we have the normal fat suppression of the abductor hallucis, but there's elevated signal intensity in both in the quadratus plantae and the flexor digitorum brevis along that medial head. So what we're seeing here, and also the muscle is smaller, so we have some atrophy. So let's get into the contents of the tarsal tunnel. The tarsal tunnel is comprised of multiple tendons, neurovascular bundle, and fascia that separate these regions. So we have the flexor retinaculum, which bounds the region of the tarsal tunnel, and the tarsal tunnel includes not only the posterior tibial tendon, the flexor digitorum and the flexor hallucis longus tendons, but the nerve, artery, and vein bundle that live between them. So the posterior tibial nerve, which are seen as multiple branches already here, is going to decussate, and branches are going to move towards the medial plantar nerve. Branches will move towards the lateral plantar nerve, and then there'll be a recurrent branch to the calcaneus. So what we're seeing in this location, we're going to look at the flexor retinaculum, which we could see that there's some mild edema. And in this region, what I'm scanning for is to see, are there any large masses? So I begin to see these structures here. Some of them will be vessels, some of them will be nerves, and we're going to follow them down. And what we do is we get to this region where there seems to be some hyperintense signal change and some enlargement, and even more bulbous changes in this region along something that looks kind of tubular. And we can take a look now in cross section. So let's take a look at that coronally. And we begin to see moving into the tarsal tunnel. So we have our posterior tibial flexor digitorum and our flexor hallucis. The flexor hallucis is always located under the sustentaculum talus. So it's something that you can always identify. And what we're seeing is that as we come towards this region of these muscles, we have some kind of enlargement in this region, in this tubular fashion, seems to be near the neurovascular bundles. Some choices for what this can be are an enlarged nerve or even plantar vein thrombosis. So looking at these structures, what I'm seeing is parallel tubular lines that for all the world look very similar to neuromas that we see in the foot. But we could be fooled. These could be dilated veins, but let's look for other clues. I don't see any other dilated veins. I see some hyperintense signal changes already in these nerves. So my suspicion is that this is going to be some type of nerve entrapment. And our next job is to tell them where this is occurring. So where this is occurring is a location called the porta pedis. And the porta pedis is that location where the abductor hallucis and the flexor digitorum brevis have a decussation. And we can see in that region, we have the neurovascular bundles that extend into this region and then decussate in both medial and lateral. So there seems to be some kind of entrapment here. And I am going to recommend an MRI with contrast now to get a better sense of the anatomy, and also an ultrasound to identify whether or not the tubular structures that I see in this location are truly compressible, and whether or not there are any dilated vascular structures, which we can add that piece on Doppler ultrasound. And that's a nice addition that's been written up in a plantar vein thrombosis paper, which I'll present. Thank you.